Good morning and good afternoon. Welcome to the Weekend Wellness Hour show. I'm excited to have a new acquaintance, Nicole Brown, joining us today talking about CBD. And I'll just tell you a little bit about her, but I'm going to let her go into her background. But she's a well known keynote speaker and CBD expert. So she also works as the chief innovation officer for a company that manufactures CBD oil and CBD products. So I am very excited to have you on today, Nicole. Thank you for joining us.
Thank you so much for having me.
This is great. So, can you tell us how did you end up in this world, in the CBD world? Like, what is your background to get there?
Certainly. So I spent most of my career in commercial product development. I worked in the alcohol industry in the wine and spirit sector for LVMH Moet Hennessy. I worked in the beauty world for Shiseido, which is a Japanese cosmetics company. And in both cases, was very focused on how to incorporate novel ingredients into products to create better products that serve consumers better. And so as my career continued and I saw the evolution and the growth of the cannabis industry, and within that, the CBD industry, my curiosity and my fascination was certainly piqued. Love to make products that satisfy people's needs, and also very much believe in the power of the plant and plant-based medicine. And so those two universes coming together was what very much drew me to intentionally join this industry and to be able to make such wonderful products that are scientifically research backed. We'll get into that a little bit here today, I think. And that's really my journey. I've been in the industry now and working for Open Book Extracts for 4 years.
Okay.
And it's been an incredible journey. There's been a lot that's happened in the past 4 years even that we'll share and talk about.
Okay, that's great. So let's break it down first. And if you could share a little bit about CBD. Not everyone is familiar with it. Some people have probably heard about it. Some have used it, haven't used it. So can you share a little bit about it?
Certainly. So CBD, which is a short name for cannabidiol, is a molecule that's found in plants. And most often when we talk about CBD, we're talking about CBD coming from the hemp plant.
Okay.
CBD can also be found in the marijuana plant as well. They're in the related genus within cannabis, certainly. And so when we're talking about CBD, we're primarily talking about the hemp industry. And so you will grow the hemp plant. And once that hemp plant is fully developed, you will have a healthy concentration of CBD within that plant. There's also a number of other cannabinoids, as they're called, that are similar to CBD, that they are molecules found in the plant, but have quite unique properties to them. And that's where you might see, if you're looking at products on a website or on shelf, you'll see things talked about like CBN, which will be included very often in products to help you sleep better, or CBG, which might be included in a product to help with overall muscular relief and so forth. So it all comes down to plant-based wellness and plant-based healing, to be able to have a plant that you can extract these different materials from to then develop and create great formulas, great products that can be very targeted to specific health needs.
Yeah, and that's great to hear it's from the hemp plant. So I know a lot of people in kind of the health food world will eat hemp seeds, and this is another aspect of that plant, correct?
Absolutely. So you have the hemp seeds themselves. So literally the seeds that start the plant, which people will consume. They have a number of great proteins and wellness benefits. Hemp seed oil, which is where you basically do an extraction of hemp seeds to create a hemp seed oil, similar to sesame seeds and sesame oil. And when you're talking about CBD, you're talking about something that comes from the actual flowers and the leaves of that plant. So again, all coming from that source of hemp, and the plant is a generous giver when it comes to all the different elements that can be helpful to us.
And that's great. And so when someone is going to a store that sells various CBD products or oils, there's such a variety out there. So how does a person know if they have no background in this? How do they know which type to get or if it's of good quality and how much?
Exactly. So
Yeah.
CBD products are sold, pretty widely
Yeah.
now. You can find them, whether it's in your local drugstore, at some of the mainstream retailers like Vitamin Shop. You can find products online, and there are a lot to choose from.
Yeah.
And so, a great place to start is certainly doing your research, whether it's coming to a website like ours, which collects very objectively different brands in the space that are taking the right measures when it comes to product quality.
Mhm.
Also, if it is at a retailer like Vitamin Shop,
Mhm.
it's always a great resource to be able to ask any of the staff who work there. They're all very well trained. It's part of their program there
Is it? Okay.
to be very educated in helping their customers select the right product. And when you're looking at that product, some of the things you can look for is looking at the label. Every product will include what's called a certificate of analysis. That is a
Okay.
third-party lab report that is validating the quality of that material. So any product you buy, you want to be able to review that, to be able to understand that it has been tested is
Okay.
one good measure. And then understanding that there's nothing in that product that would be an impurity or anything else. But I would say to keep it even more simple, it's to do some research on your own. We're a resource for that very, very often. And being able to understand, even from people in your network, whether it's your healthcare professional or others, might have great recommendations of products that work well for them that you can try. And it's always great to have that personal recommendation from someone who you trust and know, whether it's a healthcare
Yeah.
provider or otherwise, that could be really useful too.
And when you're looking at, like, let's say you find a bottle or you find something, how do you know? Do you just go by the recommendations on the bottle of how much to take then? Or is that something you should contact your healthcare professional for?
So we will always say it is always a good measure to talk to your healthcare professional.
Yeah.
Um, CBD products in particular have been quite well tested to understand any interactions and adverse effects. They are quite limited, but it's always a good step. If you're in doubt, talk to your healthcare professional first. Then, once you're looking at a product that you might want to try, whether it's to help you sleep better or just make you feel overall have a better feeling of rest, of inspiration, of relaxation,
Mhm.
you can look at the recommended serving size on the package. And we always say to, start slow, start with, the measured dose or maybe even half of that to see what's going to feel right for you. And
Mhm.
then certainly you can increase from there. If maybe you try one gummy, maybe one gummy did a little bit, you feel a little less achy, and then maybe you try two, and that might be the right dose for you. Since everyone's body is different, everyone's chemistry is a little bit
Yeah.
different.
And that brings up another question related to the mode of transportation. So, gummy versus oil versus something else. Is there a benefit to one versus the other in terms of health benefits, or is it just personal preference?
It's it's a little bit of both. So it
Okay.
certainly is personal preference.
Yeah.
When the category started, you saw lots of oils, lots of tincture-based oils, because it's a very easy format to
Yeah.
produce. Cannabinoids, CBD is an oil naturally. And as the category has evolved and matured, now you have lots of different options. You can have a gummy or a soft gel or a beverage. And
Okay.
it very much comes into what's your personal preference, the same way you look at your broader health and wellness routine. Some people love taking gummy vitamins every day. It's part of their routine. Some people prefer to put something into their smoothie and have it as a beverage. So you have different options available to you depending on what works for you.
Okay. And that's good to know. And because, some people really don't like the oils or the flavor, all that. And is there a preferred time of day to take it as well?
So time of day very much depends on what your goals are.
Okay.
And certainly if you're helping yourself to sleep better, you're going to probably take your product in the evening while you're getting ready for bed. If it's something that is more of a general part of your health and wellness routine, that could be something that's part of your morning ritual, or maybe midday. It very much depends on what fits in and what that product is ultimately going to achieve. There are certain
Okay.
products that will have more relaxation benefits. Maybe that's something that's more towards the end of your day versus something that might be more stimulating and uplifting that you could start your day with.
Yeah, that's great. And I want to kind of touch on what are all the benefits that you've seen for people's health in terms of using CBD or products or oil or whatever it is.
So there's many different use cases. The three primary are to support better sleep, relieve anxiety, and relieve pain.
Okay.
And products will be designed and formulated specifically to target each of those objectives and outcomes. So that's where you'll see products that could have CBD as a primary ingredient, maybe another cannabinoid like CBN for sleep. And what we do quite often is complementing those ingredients with other bioactives. That could be things like curcumin to help with inflammation.
Okay.
Things like passion flower or reishi, a wonderful mushroom. So you'll see this innovation starting to take shape in the category where you're combining different natural elements. We very much still have a ethos of seeking out botanicals and plant-based ingredients to complement the cannabinoids that are in there. But that's really allowing to have those products that can be quite specific to support sleep or anxiety relief or pain relief. And sometimes even combining those where you have products that will have elements that will help you sleep better and relieve pain. There's a relationship between those two very tightly that you can get both in a single product as well.
That's great. And so at your company, are you doing tests then and testing, okay, which other compound can work well with, let's say, CBD for muscle pain, and then doing studies on that and testing it on people?
Absolutely.
Okay.
We do a great deal of research ourselves with our research division, with university partners throughout the country, and with contract research organizations to conduct clinical and preclinical trials. So last year, we conducted a number of clinical studies, one looking at pain and one looking at sleep, to better understand the efficacy of certain formulations. And those studies are published on our website. You can feel free to check those out. One of the things I'll share is in the case of the study we did on pain, and over a course of 30 days, where every participant was taking their CBD product every day for 30 days, every single participant reported pain relief over the course of the study and improvements in their overall quality of life. On the sleep side, we included melatonin as an active control in the study. And our hypothesis was melatonin is a very well-known sleep aid, and many people are taking it on a daily basis, if not, throughout their lives to support sleep. Let's see if CBD and CBN and other cannabinoids can perform as well or better than melatonin. And the results from that study were validating the fact that CBD products can work as well as melatonin to help you with sleep. So it was a very validating outcome for the category, for the products at large, to help build that consumer trust that this is a plant-based ingredient and product that can work just as well as something that you're very familiar with, like melatonin.
And that's great. Have you combined the two together, or is that something that's not really conducive for helping the body if you combine melatonin plus CBD?
We have, and you'll see many products in the market that will combine both. They will work in concert together. One of the kind of pitfalls of melatonin is its relationship to your circadian rhythms. And so when you take melatonin on a regular basis, our bodies naturally produce melatonin, and you're disrupting that rhythm. So all of a sudden your body isn't producing it. And that's where people become, quite in need of melatonin just to get back on track. CBD and cannabinoids are actually the opposite. They will work with your circadian rhythms to help you achieve that balance and homeostasis. So it's something that you can take every night to help you sleep a little bit better, but you're not going to have that same disruption to your body's systems that you would experience with something like melatonin.
Yeah. And I'm glad to hear you mention that about melatonin, because I've seen studies coming out now saying that it's not great to take and to be careful with it because it disrupts your natural production of it. So I've started to point that out to different friends and clients just to make sure they're at least aware of what's coming out in the research. So it's good to hear that CBD and CBN support your natural body's hormonal process. So that's good to hear.
Exactly.
Yeah. So do we know what's happening at a physiological level when CBD is acting on the body to help with pain, sleep, or anxiety?
We do. And our bodies have what's called an endocannabinoid system. ECS is the abbreviation you'll hear.
Okay.
And the ECS, we have receptors throughout our bodies and in our brain to receive cannabinoids. And cannabinoids are found in the hemp plant. They're also found in lots of other foods that we eat and ingredients that we take, like any coliferous vegetable like Brussels sprouts, cauliflower. They're very high in cannabinoids. Echinacea, very high in cannabinoids. So our bodies are already built to be able to receive these molecules. And once they are received, if your body is out of balance, whether it's you're suffering from pain or having anxiety, it is there to help rebalance the system. Another great analog that we talk about is our microbiome. So not dissimilar from that, all of the work that's been done to understand our gut health and how if you get the microbiome and your probiotics and your prebiotics and how you can support that and how that influences many other systems in your body, your brain health, your physical health. And what scientists have discovered is there is a relationship between the microbiome and the ECS. They are redundant systems of each other. And when the body creates redundancies, it's often because it's really important. And so knowing that that relationship exists and that when you are taking CBD products on a regular basis, you're helping your body to support its overall goal of achieving that homeostasis level, of making you feel the best that you can possibly feel. How well can I sleep? How much can I feel generally calm and at peace and without pain? And that's what these products are helping to achieve.
That's interesting because we know stress and sleep deprivation both affect the microbiome. So if you have CBD that's helping promote the uptake of cannabinoids as well as helping the microbiome be more effective, I can see how that can help on many levels then.
Absolutely. And, there is, some early stage work being done to, what if there was a test you could take to understand your levels of cannabinoid? Are you deficient in one or another, to know from, the whole trend around personalized healthcare and medicine? I think that is quite possible to be able to really understand like the work that's happening with the microbiome, of knowing if you're going to those professionals who can do that analysis and know exactly what is lacking or deficient in your own systems to create something personal for you. That opportunity very much exists in a very similar fashion.
Oh, it's incredible. And in regards to sleep, do people have any side effects in the next morning when they do CBD oil and then evening for sleep?
No, that's the great thing.
Okay.
In the study we conducted, as well as, our broader research, you don't have any of the typically reported side effects, which is feeling groggy, lethargic, and kind of foggy the next morning. No adverse outcomes were reported from any of the participants in any studies we've done there. So it is another benefit is differentiated from some of the typical over-the-counter medications or melatonin where you might have that, I slept really well. I slept too well, like where it's like, oh, now I can't get up and go.
Yeah.
You wake up feeling, very refreshed, very much neutral. That homeostatic balance is very much how you feel.
Okay, that's great to hear. Now, people listening are like, okay, well, there's a lot of good things, but what about anything negative out there? Any bad side effects? Anything where people shouldn't take it if they have a certain condition?
So, when it comes to anything that's condition specific, we'll go back and say your healthcare professional should always be consulted. If you do have any chronic conditions, if you're undergoing any treatments for cancer or otherwise, you definitely want to check just to make sure there's nothing at risk there. But beyond that, this is a natural plant-based wellness ingredient that has, very, very little to be concerned about. There's been a very robust look at the safety and toxicology of CBD and some of the other constituents. And those studies have also been quite conclusive in that there is nothing at the levels of consumption of having a gummy a day or two would lead there to be any issues on that side.
Awesome. And if some of those studies looked at the long-term use, and because I know some people use it every day for months to years, do we know if there's any studies that has it been around long enough to even know that? I don't know.
Well, so the good news is, cannabis and CBD have been around for a very long time. So,
yeah.
We always joke about this where it's like, we've kind of been in the largest human unofficial clinical trial for hundreds of years. When you think about marijuana, when you think about hemp, you can go into the literature and find hemp oils being utilized in very, very, very early times for a number of different, wellness and medicine treatments. So even though anecdotally and historically, we know that, there has been certainly enough time, the CBD industry in particular, with, being about a decade old and its kind of official codification with the 2014 Farm Bill. But even before that, there have been studies conducted for long-term use or, being able to put that under kind of accelerated conditions in lab studies that there's been nothing to indicate there would be concerns at this point.
Okay. And just in even a little bit of a side note, what about for women who are expecting and pregnant? Do we know anything?
It always comes back to us women.
I know.
So look, I mean, it is, it's challenging in the entire medical space because testing anything on women who are pregnant or breastfeeding, it's a challenge. It's why primarily all of the medications we ever consume, wherever you get, they've only really been tested on men. So we do indicate that if you are pregnant or breastfeeding, we would discourage using a CBD product because it is an unknown. I will mention we are stepping into the women's health category. We actually have a study underway working with a gynecologist out of Stanford University to look at CBD for its potential treatment of PMS and menstrual pain.
Oh, wow. Okay.
So it's the first one we are looking at. And beyond that, another category that we're tackling is perimenopause and menopause. And so being able to, and if you do read the literature or even, go on some of the message boards out there, women are finding these solutions for themselves, knowing that, perimenopause and menopause is pretty much left without very good solutions at this point. If it's not hormone replacement, it's you're gonna kind of just grit it out. And we believe that there are solutions to be found in CBD and cannabis. So our first study looking at PMS and menstrual pain will have results in a couple months. And then, looking to do similarly on perimenopause and menopause, because there's such an unaddressed market need to better support women's health.
That's great.
Really is important.
Yeah. And like we said, it's hard when all the studies have been done mostly on men, and women have a very complex biology and hormonal regulation. So it's good to see that there are going to be studies that are isolating to look at those effects. And of course, people who are not familiar with it always want to know, can you get high?
Of course, always the question. So CBD, no. It is not psychoactive. It will not get you high. THC is the ingredient that is contained in hemp as well as in marijuana that does produce a psychoactive effect. Now, there are certain products that are called full spectrum products in the CBD category that will have a very small amount of THC in them. Typically not enough to produce what would be a psychoactive high. It's more an ingredient that rounds out that spectrum that's produced in the plant. But no, CBD products, and typically when you're looking for a product, it will be very clearly delineated that this product has 0% THC or it's THC free. And that will give you that extra validation that it's not a product that's going to get you high. It's very much going to just make you feel better.
Yeah. And so why would someone want to take a full spectrum product versus more of an isolated one?
Great question. So when you look at full spectrum, and its name indicates that it is containing the full spectrum of the profile of the hemp plant. So that's where you're getting CBD as that primary, all those other cannabinoids that we mentioned, all CBN and CBG and so forth, and a small amount of THC. And so there is, some literature to support, as well as, consumer preference, that you want to have something that is as close to the plant as possible. It's like, hey, I want to have the full benefit there, even with the THC, knowing that it's in a small amount and it's not going to produce a psychoactive high, versus being able to then isolate each ingredient and then create a very specified formulation. So, with the work that we do both. We do very much believe in that power of the plant and that full spectrum material and make lots of great products with it. And we also can isolate each of those different ingredients to then build a perfect formulation for what we're looking to treat and target, whether that's sleep or energy or relaxation or pain relief. So it very much gives you options on what's available and what your preferences are.
Well, that's great. And for those who are a little bit iffy and they don't really trust in using this, what's the best advice for you to give to them to just ease their fears?
So I think best advice I would give, if you're curious and you're looking to learn more, I think you can start there. If you're looking to try a product, I would recommend trying a product to help you sleep better. And, all of us, we all know how important sleep is to get good sleep. And when it comes to trying something new for the first time, it's a safe environment to be able to try a new product. You're at home, you're in your bed or near your bed. And if you're going to try something for the first time, what's the worst thing that's going to happen? Okay, you might not sleep. You might sleep not that well. My hypothesis is you'll probably sleep very nicely, but it gives you a good entry point to try a product for the first time. Most consumers in today's market, the first product they have tried and that they actually are quite loyal to is a product for sleep. So I would say whether it's taking a gummy or an oil, if that's what you like, or a capsule or a soft gel, there's many different options, but I would say it's a great one to start with to understand how it feels and how you're going to feel in what I would say is like the lowest possible risk environment to try something for the first time and see how you like it.
Yeah. And maybe on a weekend too, when
And maybe on a
you're not
weekend too,
working.
not to wake up for work where it's like, okay, I just want to like have a really good night's sleep on a Saturday and see how I feel. And then you get to have that personal experience with the product yourself and understand.
Yeah. And this is great. And I appreciate you coming on here and talking about all this because it helps provide education for people. What other things are done to help kind of get rid of some of the myths surrounding CBD to educate people more?
So for us, the research that we conduct is, very much in service of that. And, the more research that can be conducted that we can publish and share to help build that trust, to help understand where it's like, hey, here's something like melatonin that here's something like CBD that you might not know as well. And here's how they compare to each other. And here's how they have a safety profile that is measurable against each other and similar, to help build that trust, help dispel some of those myths or rumors out there. And then it very much is, working with folks like yourself, speaking at events, like publishing papers and work, just to spread the word as much as we can. We definitely see ourselves as an educator, to help anyone out there who wants to learn more, who is looking for those alternative solutions, and to help them feel more confident in making those choices for themselves.
Oh, that's great. And I imagine from what you've told us with all the processing, extracting and all that, is that part of why CBD oil is a little bit, more pricey than other types of medications and supplements?
Absolutely. When you get into the supply chain of CBD, I mean, first of all, you're starting with an ingredient that relies on cultivation and agriculture. Cultivation and agriculture is very expensive, very labor intensive, very, everything that's encompassed in just the growing process itself. Then that's just your first step. You then have to bring that into a facility like ours that has all of the quality controls and systems to be able to conduct all those processes, very similar to how different nutraceutical products get made and so forth. So there's a lot involved in putting into that little bottle or that little jar of CBD. All the steps that it takes to bring that to you are really important from a quality perspective, most of all.
Okay, that's great. I mean, all the stuff is amazing. Did we leave anything out in covering all these topics? Is there anything I didn't ask you?
I mean, I think we covered a great set of topics. I think, the exciting, future of this category is founded in the innovations that exist. The products that we're able to make today are so much more sophisticated and researched than they have been. So anyone who's out there who's curious, it's a great time to try new products, try new things. It's January. It's all the time of year we're all thinking about what we could do better for ourselves. And this is a great opportunity to do that.
Yeah. Oh, that's great. So if people want to learn more or kind of tap into some of the resources, where can they find you or get more information?
Absolutely. So you can always visit our website. It is openbookextracts.com, like an open book. And as we shared, my name's Nicole Brown. You can find me very easily on LinkedIn. I welcome anyone to reach out, even if you're just looking for a product recommendation or a specific question. Please don't hesitate. I love answering those questions. And also anyone who's looking to get into the industry from a career standpoint, from a product developer standpoint, always happy to be a resource there.
Well, thank you so much for your time today. This is wonderful. You're very well spoken. Obviously, you know this industry extremely well. So I thank you for breaking it down for us and sharing all the benefits and how it helps people. That's very important. Thank you.
Well, thank you for having me here. It was wonderful. And please keep in touch. It'd be great.
Sounds great. And thank you all for joining us today. It was a great show. Please check out Nicole's company, openbookextracts.com. Reach out to her on LinkedIn if you have more questions. She obviously, you can see she's very open and very knowledgeable. So thank you again, and we'll see you again next week. Bye now.